Like being a physician is the opportunity to actually use cutting edge science with compassion and use your hands. The field of medicine found me. Patients already come in with their diagnosis. I think it'll help doctors be a little bit more focused in getting efficient care. The missing link right now is the individuality. At the 5-year time point, patients had equal efficacy in both knees. However, the one with the surgery had elevated complications. The kicker is that your genetic disease and your aging occurs when your DNA is replicating the fastest, and that's during youth. So if you optimize the health through your youth, it sets you up for a successful future aging. Every single human is totally different, and you have to dial it in. But if you force me to make a blanket statement, just keep moving and do what feels right to you. The older I get, the more I realize pursuing things is infinitely destructive. You have to pursue connection with people. If you move, you live longer.
Today on Medicine Evolved, I'm joined by Dr. Ankur Mehta, a physician challenging the traditional idea that healing always starts with a scalpel or a prescription. Dr. Mehta works at the intersection of regenerative medicine, movement, and longevity, asking a simple but radical question: what if the body knows how to heal itself, if we give it the right conditions? The conversation is about mobility, personalization, and the future of care. That's built around prevention, not reaction. Today, we'll be speaking with Dr. Ankur Mehta, and we'll be learning a lot of interesting things. Dr. Ankur Mehta is board certified by the American Board of Physical Medicine, Rehabilitation, and the American Board of Pain Medicine. He attended medical school at the Kansas City University of Medicine and Biosciences. He completed his internship and residency at Loyola University, Chicago. During his residency, he published multiple research presentations and worked closely in the areas of orthopedic surgery and pain management. During his training, he was named chief resident and received the Department of Orthopedic Surgery Research Award. In 2010, Dr. Mehta received the prestigious American Pain Society's Fellow Scholarship. He is part of the Texas Pain Society, Texas Medical Association, and the Harris County Medical Society. He also presented his research at 5 national conferences over the last several years. He was presidency of the Harris County Medical Society West Branch. Welcome. Thank you for doing this.
Nice to see you, Greg. Thanks for having me.
So I think we share a lot of common themes. Tell me about your inspiration. What made you become a physician?
I think a lot of children, they get inspired as in the youth. The mind is so pliable. And when I was probably 6 or 7 years old, my aunt, who's an anesthesiologist, would tell me stories about different types of surgeries that she'd been through and things that she did in the hospital. And so I started shadowing. Since I joined in high school. It was before all the rules and regulations. In high school, I just walk into the ER and my aunt would just introduce me to the ER doctor and say, oh, there's a nail that needs to be drained. And we'd drill through the nail bed and blood would come out and the patient would have immediate relief. And I was just so shocked. I was like, this is amazing work. And then as I progressed, the marriage of technology, science, chemistry, biology, and the human touch all kind of, if you put it all into like a big ball of wax, it's basically being a physician. Like being a physician is the opportunity to actually use cutting edge science with compassion and use your hands. And so that kind of, the field of medicine found me. That's how I say it. So, and I don't know if I had told you this, but I was actually in pharmacy school.
I didn't know that. Yeah. Interesting.
I worked as a pharmacy technician for 3 years at Walgreens. And it was one of the most demoralizing jobs I ever had, right? They'd come with every morning you'd come in with a stack as a pharmacy tech. You'd come in with a stack of scripts and I just keep filling scripts. Patients would swipe their card, leave. I never actually got to know any of my patients. And so I realized that if I was going to be in healthcare, I wanted to actually touch somebody's life, make a difference in their life, and actually do it with cutting edge science at my fingertips.
Exactly. Your parents didn't have anything to do with this field?
So my dad was an occupational therapist, and he still is. He still works intermittently. And as a kid, I did go to work with him. And this was, like I said before, where you can just bring your kid in and they can start doing patient care. There's no clearance forms and sign-in forms and HR clearance. You just walk in the hospital, and I just started treating patients with them. And I don't know if you've ever been to an occupational therapy gym. It's just a bunch of toys.
Right.
pegboards and hoops and, puzzles. And so I kind of got exposed to it from that perspective, and then slowly advanced into surgical, interventional, and then now longevity and preventative medicine.
So PM&R just kind of resonated, just kind of grabbed you?
Yeah, PM&R is a great field. I mean, if you want to talk about like a Swiss Army knife of medical fields, there's PM&R doctors that are essentially primary care for their patients who've had strokes, spinal cord injury, things like that. And then all the way to the spectrum of, I treat kids. I have kids that have CP, cerebral palsy. I can give them Botox in their legs, all the way to, one of my patients is number 8 in the world for CrossFit. So I have the entire spectrum of care, and then even, little grandma who fell down and fractured her spine, I can repair that. So it's kind of a really, jack of all trades type of field. The breadth of care is just so cool.
Right.
That's really what
a little
drew me to
different
it.
than orthopedics, right?
Yeah. Orthopedic is broken, put a screw in it.
And bye-bye.
Yeah. See you later. Don't talk to me again. Go see the PM&R doctor.
That's awesome. Tell me about the DO pathway. A lot of people don't understand that. Can you give us a little background on that?
Sure. Okay. So osteopathic medicine is essentially the same rights. If you look at Medicare, Texas Medical Board, and basically the entire U.S. has the same exact rights as an MD, except there's 5 additional codes that osteopathic doctors can bill Medicare in addition to what an MD can do. So we've had almost 400 additional clinical hours in medical school and training of hands-on osteopathic medicine using manipulation to naturally heal the body. I mean, you and I both know, right? If your CSF is flowing, if your lymphatics are clear, if your spine is in alignment, if your blood pressure, your mental status, everything is in harmony, you don't really need a doctor. Doctor is somebody who treats somebody in a state of dis-ease.
Right.
Disease.
The sick care system.
Yes, the sick care system, exactly. And so osteopathic was, the field actually started in the World War era, when most of the pharmaceuticals were shipped over to Europe. Mm-hmm. Most of the surgical instruments shipped to Europe, and the doctors left behind were osteopaths. And they're like, well, how do we heal with just our hands? How do we heal with natural remedies? Because we don't have all these antibiotics. We don't have, the hospital system is just completely bare bones. All resources are deployed in the war. And that's kind of the birth of osteopathic medicine. And then it's kind of turned into a really great field where we just use a holistic approach to treating patients.
So it sounds like this should just be meshed together with the MD curriculum.
Kind of. I mean, it's independent in a way because of the way the thinking process. Also, if you look at the statistics, a lot of DOs usually have prior careers. So they're a little bit more well-rounded. Instead of just doing 4 years of undergrad, 4 years of med school, they usually do 4 years of undergrad, then maybe explore something else, then go into medical. And they're like, oh, you know what? Medicine's my calling. I'm going to go back. So the age, it's a little bit higher age matriculation and a little bit more diverse background. But yeah, it could be merged, but I think it has its own unique niche of patients that it helps.
Great. Well, good. So now let's talk about AI. Everybody's talking about AI. Sure. I use it daily, maybe you as well. How do you think AI is going to change your field in the next few years? What's going to happen? How do you envision your medicine in 3 to 5 years?
So I think it's going to be a lot easier for doctors because patients already come in with their diagnosis. And they'll say, Dr. Mehta, I have my bone density scan showed this. I put it into AI. My calcium level is this. My vitamin D level is this. And it's recommending these 3 things. I'll look at it and I'll say, that's correct, that's correct. You shouldn't do this because of X, Y, and Z. So I think it'll help doctors be a little bit more focused in getting efficient care. And also, I think it really helps with giving patients explanations. Because I've had patients who've had long conversations with these virtual AIs like Grok and ChatGPT, Perplexity, where they have these long conversations like, oh, I had this talk and they recommend doing this, this, this. And then I'll review it with them, verify that it's appropriate for them. And the missing link right now is the individuality. Right now, it just takes a massive breadth of research and narrows it down to one little thing, says, this is what you need. But it doesn't actually apply it personalized to the patient. And so I think that's where being a doctor is going to be a lot easier. because patients will come in with all the data.
So that's pretty exciting. What about stuff that it won't be able to do? It sounds like we'll still have jobs in 5 years, hopefully, right?
Yeah, hopefully.
But what is it still not able to do in your field?
A lot.
Yeah.
A lot. Yeah. Because, so, there's certain things we trust robots to do, right?
Mm-hmm.
I trust the robot to take my patient's blood pressure every 10 minutes.
Mm-hmm.
It automatically insufflates. There's a sensor that checks the pulses of the heart rate, pulses of the oxygen through a finger monitor. It takes all that data and feeds it to me on a sequential basis that I program it to. So that's a robot.
Mm-hmm.
But would I trust that robot or a robot to put a needle 1 millimeter away from a patient's spinal cord? Does the robot know the turgor, the loss of resistance feel? These are things that I don't think is replaceable yet. It will be.
But I think in 10 years it will, right?
I hope so. Yeah, that'd be great.
IQ of what, 250, the Tesla Optimus number 6 model.
Yeah.
I think they'll be able to do amazing sushi and probably do these things, right?
Exactly. So I saw an article that said the moment that a robot can style hair and make sushi is a moment that robots will be good at surgery.
Interesting. So you'd rather have the robot doctor surgeon, would you say, or that pretty good surgeon? What's your take?
Depends on the surgery.
Yeah.
Yeah, that's a great question. It just depends on the surgery. Look, if the patient is young, healthy, anatomically perfect, there's no osteophytes. Osteophytes are like bone spurs, like sticking out in the way, or there's like degenerative disc disease, or maybe they have epidural adhesions, things like that, where there's some scar tissue that the robot may not have been in that environment, then I probably would want a human being who's had experience with that.
Sure.
Rather than a robot that says, this is the data I got and this is what I'm supposed to do with it.
Mm-hmm.
In a perfect scenario where, you've seen the patients, like if a young kid has like a hernia, when we were in med school, we did hernia surgeries all the time, right? Mm-hmm. Or appendectomies. When you cut the tissue, everything's perfect inside. Everything's right where it's supposed to be.
Right.
Then you get a patient who's in their 60s or 70s. Granted, they usually don't get appendicitis by then, but they have obesity, they've had previous surgery, they've had a C-section. Like those types of intricacies and variations in anatomy are very difficult for me to trust an AI with, at least at this point.
Yeah, got it. So we're both aging, right? We're in the same decade, I think, right? More or less. My joints are hurting, right? And I feel like my knees are not as good as they were before. I've had 3 knee surgeries. How do I still keep doing what I love? The hiking, the skiing. I feel like I don't want a knee replacement. What is exciting down the field? What is something that will prevent me from that brutalistic surgery? What it gets you excited for some of these regenerative technologies?
Okay, so 2 answers.
Yeah.
The old school answer, instead of hiking Camelback, maybe you should just hike Memorial Park. Right? You have to, as you
lower
age,
my expectations?
lower or change them.
Okay.
Not necessarily lower, they can be different, right? You can change your expectations. You can say, hey, look, I used to, do a 25-mile bike ride. Now I do 15 and then I do some Tai Chi.
Okay.
So that's one school of thought, right?
It's a little disappointing, but okay.
It's all about perspective,
Mm-hmm.
right? At least you're still being able to bike. But yeah, sometimes this is funny. I sometimes ask my patients come in, they're like 82 years old. They say, I used to be able to do 2 18-hole rounds of golf in one afternoon. And now at 9th hole, I can barely even walk. And I say, sir, how many 80 or 82-year-old cars have you ever driven?
Yeah,
like,
I hear you.
Because that's the old school answer, right?
Right.
New school answer is you have to get it in your 30s. You have to prevent aging in your 30s.
Okay, say more.
Yeah. So
like how?
So yeah, that's a great question. So hyperbaric oxygen, red light therapy, anti-inflammatory diet, sleep, but it's almost like antithesis, right? Because in your 30s is when you want to go out and party. You can go out all night, not have an issue, wake up the next morning, and then you sacrifice your sleep for your children. Most people in their 30s are when they raise children, raise families, right? So that's the ultimate time between 30 to 40 is like when you kind of set up the next half of your life.
Okay.
Up until 25, it's pretty much you're invincible, right?
Sure.
And then 30 hits and it's like, okay, maybe I need to slow down a little bit.
So I was 30 and I had a meniscectomy, right? And I was in residency for 3 years. My left knee was killing me. But because residency is so busy, I finally did the surgery and found out I had a torn cartilage in my third year. Is that something I shouldn't have done? Or maybe we were too aggressive with these meniscectomies? What do you think?
So if there's any orthopedic surgeons out there, just mute silence your speakers. But I honestly, I've done thousands of people who are just like in their 30s, like, oh, I ran a marathon. And then at the last minute, I twisted my knee. I felt a pop. It swole up, bring them in, drain out the fluid, do a little PRP, do intense physical therapy, give them strict restrictions, but they have the time, they have the money, they have the resource to actually heal themselves. But like what you're saying, your residency, you're like up to here in suffering.
Yeah.
And you have zero time.
I didn't take the elevators. I took the stairs.
You probably shouldn't have, but especially on a bad knee. But if I would have gotten you when it first occurred, I'm 100% confident I could have helped you and not have to get. In fact, I will tell you a story about my left knee.
Go ahead.
So when I was in college, believe it or not, I was part of this Vietnamese breakdancing crew in Chicago. I was probably one of the, what would you say, like not even JV, like bench warmer on their group. Yeah. But I still did roundhouses and flares and windmills and stuff like that. And one day I came down, I lost my footing, came down, I heard this huge pop in my knee, swole up, got an MRI, meniscus was torn. Orthopedics like, okay, we need to get you on surgery. And then I talked to a DO, doctor I was rotating with. He's like, oh, no, you don't need surgery. We can heal that. So he did some traction. So he just basically took the pressure off the meniscus. He gave me these strict restrictions. Took the fluid out, put a like 10, 20% dose of steroid. Normally we put 40 of Kenalog, which is triamcinolone. Yeah. He put maybe 10, 15 milligrams. Totally calmed it down. And he says, don't bend past 90 for the next 3 weeks. Then he fixed itself.
And you continued breakdancing?
No.
You stopped?
You
canceled. Retired?
I'm retired.
Oh my gosh.
I was forced retirement.
What do you think of the Olympics in breakdancing?
Let's not talk about that one.
Okay.
We don't want to hit any political
We'll pass on that one.
There's somebody with the green outfit, I remember.
Yeah, amazing talent. So then tell me about stem cells, PRP, exosomes.
Okay, so that's a great question. So stem cells, PRP, exosomes, what are they? Let's start with one thing at a time. So stem cells, right? Yeah. You get a paper cut, and then 3 days later, it's like somehow it's fixed. And you're like, wait, I didn't do anything. I didn't spray it with that Star Trek white foam spray that heals stuff magically, because God, evolution designed you with intrinsic healing forces. And those healing forces are like growth factors and platelets and stem cells. Your bone marrow, right as we sit here, is pumping out stem cells. In fact, I think the highest concentration per ml of stem cells is actually in your sternum. But harvesting those is extremely painful.
For adults and children?
Let me refresh the research, but I think the sternum is one of the highest spots. And then the iliac crest is the most accessible. You can get it from your vertebral body, your tibia. There's tons of places in your body. They're all, everywhere you have bone marrow, there's actually like the fountain of youth is being made right now as we speak. So the way I train with Dr. Philippe Hernigot from France, he's the one who did the study where he replaced one knee, because he's an orthopedic surgeon. He replaced one knee, and patients had equally bad knees. He replaced one knee, and the other knee, he did a bone marrow injection. And at the 5-year time point, patients had equal efficacy in both knees. However, the kicker was the one with the surgery had astronomically elevated, logarithmically elevated levels of complications, infections, pain, nerve pain, burning, itching of the skin, decreased range of motion, versus the non-operative side had the same benefit without complications. So he trained me on that. We harvest it from the hip, concentrate it down, and then inject it in the joint.
Is that your favorite procedure? If we had one.
Yeah, no. All procedures at work are my favorite procedures.
Like all your children, you love them equally.
Yes, exactly. Love them equally. Yeah. But yeah, no, it's a great procedure. It's a fantastic procedure. And I've actually done it on my father. He has spine disease, spine arthritis. And as you would expect somebody in their 70s to have, right?
Sure. Everybody, I think.
There's a guy named Newton.
Mm-hmm.
He talked about
Sir Isaac, I think.
Yeah, he talked about the force of gravity.
Mm-hmm.
Nobody can escape it. There's a song kids sing about it, like ashes to ashes, we all fall down.
Yeah.
Come from ashes, go to ashes.
Mm-hmm.
So after 7.4 decades of gravity, what do you think is going to happen?
Yeah.
The spine's going to degenerate. And so, yeah, I took it out of his bone marrow, out of his hip, concentrate it down, filter out the little bone fragments, then spin it in a centrifuge, and then inject it into his facet joints.
Okay.
And he did great. In fact, the spine surgeon had to cancel the surgery. He was supposed to get a fusion.
So it sounds like spine surgeons should also do this, right?
They do. Yeah,
They do,
I have quite a few friends
Yeah.
the spine surgeons that do it. Especially now that more and more research is coming out that spine fusion is basically just buying time.
Yeah.
Because the level above it is going to go bad. Level below it's going to go bad because you're taking out one of the team members of the spine. You know, instead of five lumbar vertebrae doing the work, now you have 4 or 3, depending on the level of fusion. So those 3 workers are doing the work of 5. And so they degenerate quicker.
Interesting. So now what about the other fun things I mentioned, the exosomes? How does that fit in?
So exosomes, I'm not that convinced on.
Mm-hmm.
And I was just recently in Turkey and they were talking about plant-based exosomes where they actually harvest them from plant tissue. And so right now in the US, the exosome companies that approach me, they usually harvest it from a placenta. They get a placenta and then they put it in a medium and then they inject some stimulants that cause it to release extra proteins that are, growth factor proteins. And then they just harvest those off. Then they centrifuge them, purify them, et cetera, et cetera. But I always ask the question, I'm like, well, whose DNA is in there?
Sure.
Was it what kind of life did that placenta live before it came? Was a patient eating healthy? Were they under tremendous amount of stress? Like, do you want stem cells or exosomes from a donor like that? No. You know what? We vet every patient. There's a large questionnaire. It says, show me the questionnaire. And it's a very rudimentary thing. It's like, do you have this disease? Do you have that disease? Do you have, it's not, they're not going at a molecular level to see the inflammatory markers. Are they checking the inflammatory markers on this patient that's donating? I don't know, but so exosomes, I don't have a good answer for you. Nobody has a good answer. And if they do have a good answer, tell them to show, like what is Jerry Maguire? Show me the money.
I hear you.
Show me the money. Show me your data. Show me your time. Show me the donor. Whose placenta is creating all this,
So what about 5 years from now? What do you think the regenerative stem cell exosome world will look like? Will it be more advanced, where this will be frontline therapy?
I don't know.
You don't know?
I don't know.
You wouldn't bet your bicycle on it?
I wouldn't. I mean, it sounds cool, but if it was that good, don't you think that all these high-level athletes would be injecting exosomes in their knees and shoulders?
So what about the offshore clinics, right? You have a lot of celebrities going there, right?
Right.
They say good things. What do you think about those places?
So there's some good research on that actually, where they take adipose stem cells and they in the US, you're not allowed to use fat stem cells because it's like to like. So you can take bone marrow and put it in a knee because it's coming from a bone to a bone.
Yeah.
Right. But you can't take fat, grow it, and make millions of cells, and then concentrate those stem cells, and then inject it in like your eye or your spinal cord or something like that. We just don't do that here. I don't know. I can tell you a story about a patient that did that.
Please do.
So I have a patient. She's phenomenal, super athletic, super fit, and she hurt her knee. So her chiropractor said, "Oh, I have this connection with this company in Costa Rica, and you go there, they take your stem cells, they inject it, and somehow she got listeria in her knee.
Whoa.
I'd never even heard of that. And so it just kept on filling up and filling up. And so finally she went to orthopedic. He drained it. They found it. She was 6 weeks with IV antibiotics. So, I mean, and then there's no recourse, right?
Yeah.
Here in America, everybody is mad at the FDA because they put so many roadblocks, but in a way it's protecting us, right?
Mm-hmm.
Like that, how many people have had bad outcomes? And then the other question you ask yourself is, these celebrities that go, are they endorsing it? Do they have investment in it?
Yeah.
It's offshore. You don't have to disclose anything.
So I think Kim Kardashian recently had some stem cells, right? Did you?
I try not to follow.
You don't watch? Okay.
No, I do know that her dad was O.J. Simpson's attorney. And I do know that her claim to fame is she's extremely wizard of a businesswoman. That's the maximum I know about it.
So you wouldn't, even if for free, go to an offshore stem cell clinic and get treatment for your knees or anything like that?
My knees are doing okay, so I'm okay for now.
Well,
but
let's say they weren't. Let's say another organ or another joint.
No, I gotcha.
Right?
Yes, I understand your question. I don't know, man. I'd have to go see it.
You'd have to see it?
I'd have to see that clinic. I'd have to go there and just vet it myself. I want to see the actual clean room where they're actually manipulating my stem cells.
Mm-hmm.
I want to see how they're growing it. Are they using glass petri dishes that are used from the previous patient that they just chucked in an autoclave? Who validated the autoclave? When was the autoclave last serviced? Has it been calibrated? Did the previous petri dish hold the patient who had HIV in it or hepatitis? I don't know. Everything I do in my clinic is 100% disposable. So I throw everything away. I'm 100% confident to even do it on my patients, my father, my mother, myself. You know, these are questions that I have coming from a scientist background.
Sure. Now, I harvested our children's placenta and umbilical cord blood, right? Stem cells in those. Do you see any purpose? Because we talk about the good quality stuff. I imagine those are good quality, right? Do you see a world where something like that could be of benefit for family members?
I think I'm not sure if you and I had this discussion or with another doctor, but we talked about the best case use of that harvested umbilical cord or stem cell is actually for the sibling.
So not for the parents, but for the sibling.
Correct. The sibling, if the sibling gets like some leukemia or something, they can use that to repopulate. That was the kind of donor.
So there's
matching.
No benefit to other areas?
Not that's approved or readily done or standard. You know, if a jury of my peers were sitting here, it's like, what are you doing? You can't just take some.
Right.
We don't know. It's possible.
What about the future?
I hope so.
Yeah. Anything's possible, right?
Anything's possible. And then the other question is, you know, they had that thing in there. I think it was in Sugar Land or Clear Lake or something, where I remember one of the other doctors was telling me that he got a letter like 18 months after the occurrence happened. So there was like, you know, I think it was during like Beryl or something that they lost power for extended period of time. The generator failed. The temperature calibration failed. They couldn't get more liquid nitrogen, whatever they have to do to keep it perfect. Mm-hmm. And so they just didn't report it to any of the people holding it there. Yeah. And then 18 months later,
oopsie,
they got a letter saying, oh, we can't verify that these cells are even good. And he's like, well, what were you guys taking? You kept taking my money for the last 18 months. You didn't complain about that. And so, you know, and so taking it one step back. So a lot of the way that I analyze things and I process things is from a hardcore MIT perspective, is because of a professor at Loyola in Chicago, Leslie Wo-Mei Fung. She was the youngest professor. She was the youngest graduate to get a PhD in biophysical chemistry from MIT. And so she trained me. She's like, how do you know that? How did you verify that? She would always be like triple checking everything down to the molecular granular level. Mm-hmm. And so it's kind of put it in my head. I'm like, just because somebody says, oh yeah, we're going to maintain it. And yeah, we're going to take your stem cells and grow them and then put them back in you. I'm like, okay, well, what media are you using? Does that media have a, deleterious effect? Or the other one that I saw the other day was where the doctor was putting stem cells in the disc, nucleus pulposus of the disc. And then if you do any research, talk to ChatGPT, ask them, what is the pH of the nuclear material of the lumbar L5S1 disc? What are the cytokines in there?
Mm-hmm.
Will stem cells even survive? No, it's a caustic environment. It's not designed for maintaining vibrant cell life. And so it was kind of like, and then the study came out that, if you just inject saline, it's just as good for discogenic pain. So it's like, what are you doing? So it's there's a lot of marketing out there, billions of dollars on marketing to get people to take second mortgages on their house, to fly to XYZ or come to this clinic and we'll give you IV this and placental that and amniotic this. And it's like, who is even regulating this?
Yeah. Well, good. So then what's your longevity routine? You look pretty good.
Oh, well, I appreciate that. This goes back to one of the research papers I read that I think my longevity routine was actually my parents.
The genetics, you mean?
That's part of it, but also what they did to me when I was a kid. So I grew up Jain, so pure vegetarian diet, turmeric every other meal, turmeric this, turmeric that. Like there's turmeric in every single thing, ginger, garlic, cumin, every single thing that's coming out now that people are putting turmeric smoothies. If you go to Erewhon in LA.
I've never been, but I've heard amazing things.
Just bring your wallet. You might as well just leave it there. But $20 smoothies, turmeric this and, maca that. And, so I think the kicker is this. Your genetic disease and your aging occurs when your DNA is replicating the fastest, when your cells are replicating the fastest. And that's during youth.
Mm.
So if you optimize the health through your youth, it sets you up for a successful future aging because your telomeres have not taken hits from 0 until 20, let's say, because you've been having almost like zero inflammation in your diet. Your blood has been pretty much in a pH balanced state being vegetarian, right?
Mm-hmm.
And so the time when it was most susceptible for degradation was protected by this diet.
So do your kids follow that?
Hell no. They're American.
Americanized all the way.
Americanized.
So that's kind of true with mine as well, right? Our children are exposed to so many different things that we were, right? And that worries me, right? This experiment of iPads and microplastics, nanoplastics everywhere, and the ease of things, right? And how do you go about that? Day by day?
Yeah, it's a day-by-day battle, man. And think about it. If you give a dog a bowl of bacon, it's going to eat it in 2 seconds.
Sure.
It's like it's salivating before it even put on the ground, right?
A bag of popcorn, I might go through it as well.
Yeah, same thing. So and imagine a kid with no frontal lobe development. You feed them dopamine, they're going to eat it up through swiping, through watching YouTube videos, through eating these packaged Airhead candies or Starburst. And, I don't know if you know, there's a new thing now where they get these exotic candies and ice creams that are shaped like fruits. I mean, it looks like a real fruit.
I did not know about that.
It costs like $12 per candy fruit, like a ice cream popsicle thing.
And crumble cookie, right? Not to give brands, but there's an explosion.
Let me stop you right there. One crumble cookie has enough sugar. The FDA recommended sugar allowance for a kid for 3 days.
Wow. Yeah.
And these kids are eating like 3 of them. Well,
and then they want ice cream, right?
Oh yeah, can we put ice cream on top? And then there's a Pizookie now. Have you heard of that? They take a huge cookie and they put a brownie on it and they put ice cream on top of it. It's all hot and gushy and it melts.
Yeah.
And then they put whipped cream on top with sprinkles. And so, I don't know. Anyways,
I mean, I see a future where obesity is optional, but only for certain adults, right? Because if kids are going down this pathway, I think they'll be stuck. What do you think?
for sure, man.
Because we have GLPs, which are, I think, pretty amazing, right?
Your beta islet cells can only do so much. They're tapped out. I mean, what was one of the endocrinologists was talking to? He said diabetes starts when you're born, even before you're born, when you're conceived in your mother. How much your mother's sugars are changes the way that your pancreas is developed.
Like the epigenetic signals pathways?
No, not even epigenetic, just environmental. The mother's blood sugar level changes the way the pancreas develops and the susceptibility to insulin.
So in this time of comfort, right, we might be living shorter then, right?
Yeah. Oh, yeah. 100%.
You have centenarians, which are getting to that point, but what if that's not really going to be the case as much? Right. I would hope it will be, but
I mean, they grew up in the golden years of the world, right?
Yeah.
They grew up with like non-GMO. They grew up where the TV had 2 channels, and after 8 p.m., there's nothing to watch on TV.
You go to bed.
There's maybe 1 phone per neighborhood. You just have to interact on a human basis. How humans have evolved over 10,000 generations, and then within 1 generation, boom, we changed it. So,
and it's getting faster.
Oh yeah, I mean it's logarithmic, man. The faster technology evolves, the faster. But I have faith in humanity. I do. I think we're gonna make it.
Because we always figure it out at the last moment, right?
There's gonna be a ton of fallout.
Yeah.
You and I are probably the fallout.
Yeah.
People living right now
are the
innocent bystanders.
We are the manure for the next generation.
Correct. Yeah. Yeah. But it's okay. I mean, you need to fertilize the soil with something, right?
Sadly, yes. Well, let's talk about that new generation. Some kids going into medical school training, they're thinking about a career like this. What would you tell them in this crazy world we live in?
I'm going to do it. There's no better field. There's no better job in the world than being a doctor, because you are relevant even if you're sitting in a room by yourself, because you can understand your physiology. Let me give you a story. This is a good one. So I was in Italy. I just graduated from medical school, and we were on these speed trains. They go, between Florence and Milan and stuff like that. And so I think we were actually from Florence to Milan, and it was like an early morning train, like probably 7 a.m. Got on the train going, and then we're sitting in this, how they're little cabins, like 6 people per cabin. So we're sitting there talking to this couple there, and they started, medical. And she's like, oh, aren't you a doctor? I'm like, yeah, I'm a doctor. She's like, they need a doctor. I'm like, why? What's happening? She's like, I don't know, but they're asking if anybody's a doctor on the train, because the train's going, so they can't just like stop it.
Yeah.
And so I was like, yeah, I guess I can help. And so I went down a couple, car lengths, and there was a kid was having a seizure. And so even though I didn't speak Italian, I knew the human body, I knew anatomy, I knew medical, I knew physiology, I knew what to do, helped the kid out, got the meds, put him in a position where he wouldn't hurt himself. These are types of things that, like, having that knowledge, even if you put me on the moon, I'm relevant. If the economy goes to zero, Bitcoin goes to zero, gold goes to zero, who knows? I'm still relevant as long as there's another human being around, or even myself around. So being a doctor is kind of like opening or unraveling God's design. Like, you're able to see inside and help take from a state of dis-ease to ease. So I definitely recommend it. I mean, in a state, as Elon Musk and many others have said, and I think Google did this study as well, where a place of not just standard minimal income, but standard maximal income, or standard high quality of life. Everybody's going to have abundance in theory. If AI solves all of the production problems, if we have, Tesla bots harvesting corn for us and optimizing processes, then we can all live in such a state of prosperity that it would be even more relevant to know and optimize the human body. So I'd say do it.
So you think we'll have a UBI abundant future?
I hope so.
Yeah.
I have no choice but to be optimistic because I have children.
Yeah. What do you tell your children as far as coaching them into
So you're the
fields?
future. You better figure it out. I'm on the way out to retirement.
Do they ever come to work with you? Or do they ever check out the clinic?
They do. Yeah. Oh yeah. They've come to work with me a couple times.
Do they ever say those words, I want to be a doctor or anything like that?
Well, it's funny because the other day I had a question. Oh, should I be an engineer? I'm saying, yeah. Invent something, create something, be a creator. I don't care what you do. Create art, create wine, create something. Don't just be a consumer.
Yeah. Beautiful. Well, if you could leave an actionable idea to protect mobility and function for people now, what would that be? What's something that we can do to keep people going? That's something that's always kind of, tugged at me. You get older. Is it zone 2? Is it squats? What is it? So
the answer is you have to optimize yourself. For somebody who wakes up at 4 a.m. and does a 1.5 hour workout before their day starts and their inflammatory markers are 0, keep doing it. For somebody who, like myself, if I woke up at 4 a.m, my inflammatory markers would be off the chart. I need my sleep. Every single human is totally different and you have to dial it in. Like this morning, for example, I got my fasting insulin checked. I got my cortisol checked, got my testosterone checked. I'm trending. What works for me? So these are the types of things that we can really optimize human aging with.
Sure.
So there's no one direct answer, but if you force me to make a blanket statement, just keep moving and do what feels right to you.
What about wearables? What's your favorite wearable?
So far, I'm on Whoop, no affiliation, but I like it. It's very accurate, and I can't stand anything on my fingers except for my wedding ring. I used to have the Aura ring, and then it just. But the Whoop is great. I mean, it gives good data, and
do you have good sleep scores?
I do, surprisingly.
Yeah.
Surprisingly, I have great sleep scores in spite of having 3 kids. Yeah. You know the really cool thing about the Whoop?
What's that?
Is it can predict
sickness, right?
Yeah. It's like, oh, you know what? Your respiratory rate's normally 14, and now you're breathing at 14.8, and your basal temperature's up 0.2 degrees, and your resting heart rate's up a little bit. Viral infection inbound.
So what do you do then?
Zinc, vitamin D, calcium, vitamin C. Just load up on the multivitamin.
And it saved you most times?
Yeah. You know what I've also found interesting? I don't know if you have experience with this, but shaga mushroom powder. Have you tried that?
I think I actually added some today. My wife is filling our cabinet with so many goodies, so added that to our shake. Yeah.
Yeah. I need to get mine lead tested before I start.
That's the sad thing about the world. All the stuff in our food, oceans, supplements, water, air, right? Depressing. I don't know about you, but I tested myself for some of these things, and I found I had cesium.
Really?
In my body. I had cadmium. I had other things, right? And if you recall, there was a Walmart shrimp recall about 2 weeks ago, radioactive shrimp.
No way.
Guess what they had? Cesium. Now,
so like nuclear,
like radioactive stuff in the seafood.
So basically, they harvested it from the ocean,
and
it had nuclear. Maybe they did nuclear testing in that area or something.
I don't know. There's runoff. It's very complicated, but that is just one time when it was captured. Imagine, and it below it broke certain threshold. Yes,
where they're like, oh yeah, I guess the economic benefit outweighs the risk.
Right. So that was one red flag. Now, I don't know where I ingested it, but I had it. And I could have paid hundreds of dollars for amazing sushi. And now that sushi is actually knocking me off, right? That's what irritates me, right? Where you go to all these beautiful places, you even go to a nice hotel, and you go in and they're using some solvent or something, and then you're just not getting the best life. But you can't live life and be paranoid. But still, that's life, right?
So, let me give you an example. And I did this in my biophysical chemistry class.
Mhm.
And this was before anybody was talking about microtoxins and plastics and all that stuff.
And I never talked about it too. I thought these people were not quite there, but
It's real.
It's real. Yeah.
So there's a couple things. There's so in our dishware that we would use, dishware like Petri dishes and Pyrex flask, Erlenmeyer flask, and graduated cylinders, all that stuff, right?
Yeah.
I would be in charge of washing my own stuff. So we had like 3-phase wash out the protein, then wash it with the base, wash it with an acid, then distilled water, then DI water again, like 3 or 4 rounds of it, right?
We went really deep there. Half the people probably don't even know what
Well,
that
if they're going
is.
to med school, they better know that
Right,
stuff.
right.
But, and so one of the concepts that the professor, that Leslie Wo-Mei Feng, taught me, she says, how do you know that there's not a little film inside of your container of the solvent that you used that's interfering with your experiment? And then I looked at like the dishwasher and you put anti-watermark chemical, then you put this chemical and that chemical, and then you put those little pods. It's got like 6 colors in there.
Exactly.
Well, you know how much blue.
So you're supposed to wash your dishes after you wash them in the dishwasher, so you get that
with the
stuff
DI
off of
water.
them. Yes.
Because then you take the meal, you put your pasta on your plate or whatever you're eating.
And I'm sure it's the best pasta ever, right?
Of course. Stick it in the microwave, and then now you heat it and you aerosolize, or you
Exactly.
it
just
leaches into the
cycle.
food
Yeah.
of whatever was in that Shine Plus
And this is at your home.
at your home.
Where you can control everything.
Dude, I'm telling you, man. Like, so I've come to grips with death. I said, look, I don't care. I'm just going to live a good life. If I die at 80, I die at 80. If I die at 150, I die at 150. I don't care. I'm not going to try to like micromanage and pristinely clear out. I mean, people back then were, breathing asbestos. It's just a byproduct.
Sure.
I'm not trying to, live forever. I just want to maximize the time while I'm here. Lifespan, health span, not lifespan, right?
Maybe both.
Maybe both. Yeah. But no, these are things I think about, and it's kind of incompatible with the Western life.
Right. Our grandparents didn't hop on a jet airplane and go overseas as much. They didn't have fancy sushi. They didn't live in some of these homes that are off-gassing these other chemicals, right?
Yeah. I mean, you go from, you even taxi in an airplane.
You're
and then
getting solvents.
The jet fuel exhaust,
Yes.
as a plane backs up, it's coming in.
Right.
Right. You're getting radiation in the air. Like, if you really whittle it away, you just need to move to like Wyoming somewhere.
Well, then radon exposure from the mountains, right? So it's this
Yeah.
game and always something on the
So-
way to work. I swear there's like a car fire every other day, right? On I-10.
Now that they stopped.
Luckily, I have a Tesla, so I push that,
Biohazard.
but sometimes I forget.
No, and that's and here's the other thing. This is, we're going way off topic, but this is kind of interesting. The Tesla has insane amounts of EMF radiation.
But it's shielded, I believe, right?
Shielded from with what? From where? By who?
So we're getting microwaved.
By who? Like you have like you
So
have.
I need to wear Faraday. I need a Faraday jacket.
But then if you go in your F-150 pickup truck, your diesel truck, you're inhaling all those carcinogenic particulate exhaust matter. So it's like,
So the Amish have it figured out.
yeah, but more people die of like horse injuries.
That's right.
So living Western life is a slow, gentle death. It's okay. You just got to live it. Enjoy it.
Because you can't have no stress. You can't have a Wall-E existence, right?
No, you can't.
Did you ever watch that movie?
Yeah.
Yeah. I feel that's part of where we're going.
That went the other way too, right?
Where
everybody was just kind of constantly in a straight dopamine. It's like dopamine IV, But
yes,
to answer your question succinctly, I do as much as I can. I try to, with the data that I have and the control that I have, I accept it and I make small tweaks, and then I also just enjoy life because you never anything
you
could
never
happen.
know. No guarantees.
No guarantees, right?
anything that you've changed your mind on 10 years ago you thought was just nuts and crazy, and now you're like, this is actually pretty amazing and we should consider it? Psychedelics?
No, I think meditation and prayer.
You thought it was maybe nonsense? Is that what you're saying?
I mean, which 20-year-old believes in that?
I don't
Or
know.
30-year-old?
You might be surprised.
Yeah, maybe I would. Hopefully I am.
Okay.
That's good. That would.
So you believe in God?
Believe in God, believe in being able to connect with oneness, connect with a source that is greater than everyone around you, greater than yourself, and greater than even the world. But the cool thing is, if you really meditate, and so I studied theology in college.
Really?
Yeah, I went to Loyola. It was like required.
Right.
Like
Catholic.
Catholic school, yep.
But you were not raised Catholic.
Oh, I went to Catholic school pretty much my whole life.
Okay.
But one of the interesting things is that when you read through all the scriptures, like the Quran, Judaism, Christianity, Buddhism, Hinduism, Jainism, all the isms of the world, right? They all have one common theme, is that you need to connect with the oneness. And the oneness is basically your ability to connect to something greater than yourself and the world. And I think that's, in this day and age, I'm realizing that you can be optimized sleep, 98% sleep, you're 8.25% body fat, cold plunge every morning, eat beef tallow,
weigh out your food,
eggs. Yeah, everything is like perfectly optimized. But if you are not in harmony with God or oneness, then you have nothing.
So like a North Star, also like a purpose.
Yeah, purpose.
Like Viktor Frankl saying, if you have a why, you can do anything, basically.
Right.
You can endure.
Exactly. Yeah. And so, I mean, life is basically one big Stockholm syndrome.
Sure. You think we have a simulation? We're in a simulation? Every few weeks, I think the chances are higher. If you asked me 5 years ago, I would have thought never.
We will be soon.
We will be soon.
So this is analog. You and I are doing analog. It's going to get digitized.
Yeah.
It's going to go in the assimilation. And then the AI will now have us assimilated into the AI. So I think humanity is assimilating into this simulation.
That beehive creature where we're all connected.
Yeah.
Yeah.
Mission Impossible 7.
17 maybe.
Was it Skynet?
Yeah. Scary. Well, what's your compelling reason as we close up just for being here? I think you've kind of explained it, but anything else we should know about you?
The older I get, the more I realize that pursuing things is infinitely destructive to happiness. Or forget about happiness, contentedness or wholeness. You have to pursue connection.
With people.
With people, exactly.
Yeah, I think it's the number needed to treat in a way. Like you need a family member, a good friend. You don't need 100 people, right? You just need the quality there.
Right.
Well, where can people find you in this lovely city and online?
So my practice is in Memorial City, and online we're at TX Spine and Joint, all spelled out, .com. And love to help optimize movement, because if you move, you live longer.
Exactly. Dr. Mehta reminds us that the future of medicine may not be louder, faster, or more invasive, but more personal, more intuitive, and more rooted in how we move through the world every day. If healing is a relationship between the body and its environment, then prevention becomes the most powerful medicine we have. This is Medicine Involved, where innovation meets humanity.